Colts quarterback Anthony Richardson was ruled out of today's game with a right shoulder injury suffered on this play, and in this video we're going to take a look at what could have happened and how long the Colts young star quarterback might be out. Welcome back everybody, I'm Dr. Brian Sutterer, and my goal on this channel is to help teach you about the medical side of the sports world. So if anatomy and that sort of thing interests you, then please consider subscribing along. Let's go straight to the play where this happened for Richardson and focus again on his right shoulder. As we can see him land on the ground, there's no real direct impact or trauma to the shoulder. It looks like one of the Titans players comes in and hits him a little bit with kind of that head right there, but hits more on the left side of Richardson. So really this is a direct load into the outside of Richardson's shoulder. As he comes down, his right arm gets tucked a little bit in an adducted position, kind of in across his body, but then a lot of the load when he lands on the turf is going to drive this force up through the outside of the shoulder and particularly raise concern for something like a clavicle injury or an AC joint injury. Something like a shoulder dislocation subluxation labrum tear would also be in the differential, but this will be the most common mechanism we'd see with an AC sprain or an AC separation. Right away, we could see Richardson pointing at that right shoulder when he was down on the ground in quite a bit of pain. And then even as he came off the field later on, we could see how the arm was just kind of hanging down at his side. I will say it was nice to see at the start of the second half he was still questionable, so presumably they were able to do some x-rays over halftime and not see anything broken. That would be the hope here. But let's look at our anatomy tool to kind of talk through the differential. So the first thing I mentioned is an AC joint injury. AC stands for acromioclavicular, so it's the shoulder joint between the acromion of the scapula, which is this prominence of the scapula, and then of course the clavicle. So this ligament sitting right here is the AC joint. Whenever we kind of look from the top down, if you imagine Richardson's shoulder coming into the turf this way, all of that turf force is going to be transmitted in up through that AC joint, potentially leading to a clavicle fracture or an AC joint injury, even more severe, something over like an SC joint, which didn't at least seem to be where he was having pain. Whenever we talk about AC joint injuries, we grade them based on something called the Rockwood classification. So not necessarily a grade 1, 2, 3, but the type of injury. A type 1 is the most mild, where there's just been some spraining of these acromioclavicular ligaments, but everything looks normal on the x-ray. Nothing is widened or displaced. Type 2, we're going to see some widening of this interval because these ligaments have now been torn. Still treated conservatively, maybe 2, 3, 4 weeks. Type 3 is where it gets more severe. And in type 3, we've started to see damage of this coricoclavicular ligament group sitting over here that helps keep the clavicle decreased down and depressed in the shoulder by anchoring onto this coracoid process. Whenever we see a complete tear through these ligaments, we know there's also been a tear here, and so the clavicle will elevate upwards on x-ray and be an x-ray sign of a more significant AC joint injury. And again, not something that you'd keep a player questionable. If you saw type 3, they would be ruled out for the rest of the game. So AC joint, number one thing I'd worry about, of course, after making sure that there's no fracture to the clavicle. The other two things just to keep in mind here, whenever you get that arm adducted across you in that position, you're going to put your shoulder joint in a little bit of a compromised position where you could have some subluxation of the true ball and socket glenohumeral joint. Of course, when that happens, you can irritate or injure the labrum in the shoulder, and a labrum injury in a quarterback throwing shoulder would be a much more significant and serious thing. So hopefully that's not the case. Hopefully we're just dealing with the AC joint. And the third thing I'll mention here is just neurologic type injuries. So the brachial plexus is this group of nerves that come out of the spinal cord and then bunch up together within this area of the neck. Those nerves then travel behind the clavicle down through the arm to help innervate the muscles in the arm. And anytime you have trauma load through the scapula, through the clavicle, you can have some irritation possibly of these nerves. And so certainly the team will do some neurologic testing to make sure we're not dealing with more of a brachial plexus stinger type of injury. So keeping that anatomy in mind, let's look through this play one more time. We see Richardson go down. As he lands, that right elbow gets bent upwards, kind of tucked into a little bit of an AD adducted position. And then as he lands on the turf, a lot of force gets driven actually up through his AC joint from the outside of the shoulder. Most likely, I think, leading to something called an AC sprain or shoulder separation, which, assuming there's no broken bones and no widening or clavicle elevation on x-ray, is an injury that typically is not going to be that severe and might be on the order of just a couple to a few weeks rather than months or season ending. That's it for the video, everybody. Let me know as always any questions or comments down below. Thanks for watching, and until next time, we'll see you later. Bye.